Hi, everybody, and welcome to this webinar on understanding the special notice of funding opportunity that HUD recently released to address unsheltered and rural homelessness. My name is Ann Oliva. I am the CEO of the National Alliance to End Homelessness. And Josh, you want to introduce yourself?
Yes. Well, good afternoon, everybody. I'm Josh Johnson. I'm the Senior Technical Assistant Specialist here at the National Alliance to End Homelessness. I go by he, him, his pronouns.
Thanks for the reminder, Josh. I go by she, her pronouns as well. It is great being here with all of you today, and we're excited to have a robust conversation about this topic. So we have about an hour together today, and we're going to present an overview of how we hope to see continuums of care across the country approaching this NOFO, alongside some key details that you should be thinking about as you prepare your plan and your application. We're going to start with talking a bit about systems level thinking and system flow. While this NOFO is intended to specifically reduce unsheltered homelessness and serve people with severe service needs, we all know that people move from unsheltered locations into shelters and in and out of other systems regularly. So we really need to contextualize your plan and this application and this work within the broader homelessness and affordable housing systems thinking that we're all doing right now. And Josh is going to walk us through some thoughts on that. Then we're going to talk a bit about centering equity and serving historically marginalized groups through this opportunity before we dive into the high-level details of this NOFO and what things the Alliance thinks you should be considering sooner rather than later. We also intend to take questions at the end, so please feel free to put questions in the chat. Our own Christy Schulenberg is monitoring that chat and will be giving us some questions that we can answer at the end. It's so nice to see all of you. Nice to see folks introducing themselves in the chat. Really appreciate it. So before we get started, I will do a standard caveat, and that is that we are not the Department of Housing and Urban Development here. While I used to be there, I no longer represent them. So we really encourage you to obviously participate and listen in on this webinar today, but also make sure that you're reading the NOFO and the application materials in their entirety, because there's tons of detail in those documents that we just won't be able to cover today. So let's go ahead and get started. Can we go to the next slide, please? And I just want to make sure that we are recording. I think that somebody might need to hit the record button.
We are recording.
Outstanding. Thank you.
All right.
Great. Thanks, Josh. I'm turning it over to you.
Thanks so much, Ann. So again, what is a webinar without the obligatory housekeeping? So just as you know, everyone's muted. We strongly encourage you to use the chat, ask questions, introduce yourself, let folks know where you are, joining us from. We will, as we just ensured, this webinar is recorded, and we will make the PowerPoint available at a later date. And just to highlight what Ann said, we are not HUD, okay? So I wanted to do a refresher. I'm sure a lot of you all who've been to our webinar before know what our goal is when we talk about think about system level, make system level decisions with the goal of ensuring that your system is effective, efficient, and equitable, and it quickly moves folks out of homelessness into housing, and when safe and appropriate, diverts folks away from the homeless system. Again, ensuring that when it's safe and when it's appropriate. Communities that have done a great job of demonstrating this from a systems perspective have a very strong housing first approach. evident by focusing and helping folks who are experiencing homelessness access housing as quickly as possible with no barriers to entry. These systems have proven to get better results and utilize less resources. Also, lessening the potential traumatic exposure related to that homelessness experience. We always like to say, start with the end in mind, right? This is the end, right? This is the goal, is to have folks who enter the system be diverted when possible and move through the system quickly as possible into housing. So as you're thinking about this NOFO and this opportunity to meet the needs of folks who are unsheltered, think about it from that system perspective. We love to highlight the roundabout, right, in which should represent the system flow, right? Folks enter the roundabout and they exit out. But if something is keeping them from entering, right, if we're not reaching out to the folks who are category 1 homeless, right, if they're unsheltered, if we're not even able to pull them into the system, then that is something we need to look at. Our folks who enter the system are not able to run smoothly through the system into housing. That is another thing to look at. So when we make decisions and we're looking at our plan for this NOFO, think about how it fits into the larger system and the larger system flow, which is entering and diverting when possible at entry and then exiting quickly into housing. For systems who do not have who have a poor system flow, it might look like a system that is stuck, right? You might see the unchanging or increasing numbers for folks who are unsheltered. You might see long wait lists for shelter. You might see the length of stays being long, more than 30 days, high percentage of exits from shelter into homelessness, average length of stay not decreasing, and just some of the other ones, not to read all the ones on the screen. So these are some of the symptoms of a system that has a poor workflow. And as you think about, again, with that end being in mind, how can you utilize this opportunity to not only meet the needs of folks who are unsheltered, but also meet the needs for the system as a whole? So I just want to do that kind of that baseline information of kind of what that system level you should be looking at. And I'll pass it to Ann to introduce the unsheltered and rural NOFO opportunity.
Great. Thank you so much, Josh. I think it's really important for folks to think about those system level issues and that flow through the system, because HUD is definitely leaning in on reducing unsheltered homelessness through this NOFO, but it really has implications throughout the whole system. So I think that was a really good sort of primer on how you should be thinking about this work. So before Josh starts to walk us through some of the key technical information that everybody needs to be clear on, we wanted to take a moment to talk about what this NOFO represents in terms of opportunity. And we're thinking about this here over at the Alliance. We're thinking about this in sort of 3 key ways. So the first thing that I want to note for folks, that I'm not sure that folks who aren't steeped in all of the federal processes would really pick up on, that I think is just an important piece of context, is that this NOFO was not specifically appropriated. It was not money specifically appropriated for this purpose. It's an important point because for programs like the Youth Homelessness Demonstration Program or the Domestic Violence Set Aside, Congress actually directs HUD to set aside funding for that particular purpose. And that is not the case for this notice of funding opportunity, which is basically funded from money that is recaptured from Continuum of Care grants over time. So in other words, or in plainer English, HUD is choosing to spend their recaptured dollars in this particular way, which should be a really strong cue and indication for you all in the field that this is a priority area for both the department at HUD, but also for the administration. So I think that that's really important context to think about as we are moving forward and putting together our plans for this NOFO. And therefore, because of that context, communities should really see this NOFO as a driver to develop a comprehensive plan on unsheltered homelessness, even if you aren't sure that you want to apply, or if you're not sure that your continuum of care will be competitive for this limited funding. I suspect, although obviously, again, I am not HUD and can't be 100% certain, but I suspect that having this type of plan in place will not only help people who are experiencing unsheltered homelessness in your community, but actually will help you be more responsive to the regular continuum of care application in the future. And before I move to the other two opportunities, I want to just provide a side note here. If there are, as a person who used to read all of the continuum of care applications that came into HUD, and because as far as we can tell in terms of timing, the regular continuum of care application will open and close during the period of time when this application is open. So we're actually doing that, all of that work sort of at the same time. I would encourage you, if there are questions on both applications, on both continuum of care, the regular continuum of care application and this special unsheltered and rural homelessness application that are the same, please put the same answer in both places. What that indicates to HUD is that you have a consistent and cohesive plan that sits in, that encompasses both planning processes. So that was just my side note. So again, communities really should think about this not just as an opportunity to apply for this particular NOFO, but to really use this as a driver to develop a comprehensive plan on unsheltered homelessness. The second sort of bucket of opportunity that we see is really around building capacity in rural and tribal areas that have not received continuum of care funding previously and that have high needs. So there's, you know, the rural set aside that can be used in rural areas that have high need and that haven't had a COC program funded in it in the past, but also to serve those tribal areas like trust lands and reservations that haven't been historically eligible for COC dollars. This is an opportunity to put some services and housing in those areas as long as you're working in partnership with those communities. And then what I think is likely most important of these three buckets of opportunity, I really want to turn your attention to this middle square on this slide. Many of you know as well or better than I do that there is a growing and very vocal movement in some states and local areas by groups that I might define as hostile to people experiencing homelessness, or that are being driven by sort of ill-informed officials that promote ordinances and state or local laws that are pro-criminalization, anti-housing first, and anti-evidence-based approaches. So what this NOFO represents is really an opportunity for the viable and sort of correct alternative to those types of measures. Use this at the local level as an opportunity to create momentum towards reversing course on those punitive, racist, and traumatizing practices and policies and instead double down on what we know works. So as you're thinking about the way that you are putting together your process and the way that you're putting together your plan, I would encourage everybody to think about these 3 types of opportunities. And I just want to check, there seems to be some stuff in the chat about folks not being able to see the slides. Are we good now?
I think we're good now. People are starting to say that they can't see it. So it might have been a little glitch, but it looks like we're good.
Outstanding. Josh, I'm turning it back over to you.
Well, thank you so much, Anne, for just for that introduction to the some of the core components of this NOFO. I'm just going to go over just the high level information. Hopefully, I think you guys can hear me and see me. So the NOFO made approximately 322 million available, with 54.5 being for the rural homeless set aside, and 267.5 million being for unsheltered, for the unsheltered homeless set aside. So this is for CoCs that have high levels of unsheltered homelessness and a comprehensive plan to reduce unsheltered homelessness. But like Ann said, encourage folks to, all folks apply, and also to work towards that creating that comprehensive plan to meet some of the needs of some of the most vulnerable in your community. So here are some of the important dates, just ensuring that you all have these, with the important date being October 20th, when the submission deadline. And you all will have copies of this PowerPoint as well, if you guys want to keep record of any of these dates. We also, just some of the principles we encourage you to follow with working towards this NOFO application is we recommend that communities are urgent and equitable, and also intentional with the work they're doing, ensuring that you're working to and aligning a plan that meet the needs of individual and families in your community, while utilizing a housing first approach / principles and practices. And this must be done in collaboration with partners, including but not limited to healthcare providers, housing providers, programs or organizations that work for older adults, and also the VA, right? And then also tribal entities. And this is not an exhaustive list. This is just some of the folks who you need to have around you collaborating to meet the needs of some of the most vulnerable folks in your community. And then also, like we talked about, kind of centering equity, right? Why are we centering equity? Because we know that centering equity is crucial with this work, right? We know that BIPOC folks are disproportionately represented in the homeless system. We know that's due to historical policies and events that's created and perpetuated social inequities, right? We also know that LGBTQ plus folks are overrepresented as well, and we need to make sure that our systems are not perpetuating these inequities and are welcoming all folks and housing all folks who enter the system. With that said, we know that a lot of the structural issues that lead to a lot of feeder systems, for example, the criminal justice system, they feed into the homeless system, and those are partners as well who we need to work with. But we also want to ensure that our programs are not perpetuating these disparities, right? We know that we can, either through how we prioritize, what we use to prioritize, what type of services are offered, are they culturally responsive, where our programs offered within the communities, who's providing or informing what's being offered. Those are all things you need to consider in regards to addressing inequities. And also understanding our responsibility to ensure, we are not we are not having any disparate impact with our decisions that we're making. We're using the equity, racial equity lens with the approaches that we are applying, we are utilizing. And then equity always should be in the center of what we're doing. But the NOFO again, incentivizes equity, right? There's actually points awarded for communities who demonstrate an equitable approach to how they're going to work to end unsheltered homelessness and address rural homelessness. So it's the right thing to do, but also it's incentivized. So we encourage you to center that equity within all the work that you already do. So I'll pass it on to Ann to kind of talk a little bit more about the priorities and the funding with the NOFO.
Great, thanks, Josh. You'll see it reflected in some of the upcoming slides, but I just want to put just another point on those that Josh just made around the importance of centering equity and ensuring that we are serving historically marginalized populations and people who are more likely to become homeless as part of this plan. Not only are there points attached to it, but it is also the right approach to take from a broader affordable housing and homelessness perspective. So now let's turn a little bit to HUD's policy priorities and funding. Generally, HUD indicates what their NOFO priorities are in two big ways. First is by having a section in the NOFO that explains what their policy priorities are. That means like what they want to achieve with this particular funding opportunity. And then second, we read into what their priorities are by how they score the actual applications. So let's start walking through some of those details. And we'll start with HUD's stated policy priorities in this NOFO. So there's 6 of them. There's only 6. This is more than $300 million, and there's 6 clear policy priorities that HUD wants to achieve and that they want communities to achieve. So they're really looking for these comprehensive community plans that accomplish these 6 things. First, they are specifically looking to reduce unsheltered homelessness by connecting people who are living unsheltered, including people who are in encampments, to housing, healthcare, and behavioral health services. Can we go? Yeah, that's great. They also want to make sure that we have the best data available on people who are experiencing unsheltered homelessness so that these plans are actually reflective of the people who are in these situations. Second, they want to build capacity and reduce unsheltered homelessness in rural areas, specifically addressing the unique circumstances that are present in rural areas. Projects under the rural housing set aside or the rural homelessness set aside can use flexibility that is provided through this NOFO on new eligible activities. So I want to be clear here that HUD is actually providing some flexibility for communities who want to fund projects in these rural and tribal areas by providing new eligible activities. For example, if you look at page 21 of the NOFO, it includes rural specific eligible activities like capacity building or repairs to housing to make buildings habitable. So there are some differences in the eligible activities between the unsheltered set aside and the rural homelessness set aside. And communities, in order to achieve this policy priority, really need to think about how to use those flexibilities on the rural side to reduce unsheltered homelessness and serve individuals and families experiencing homelessness with severe service needs in those rural areas. HUD is also specifically interested in providing assistance on tribal lands, including those areas that were in years past ineligible for continuum of care funding, like trust lands and reservations. Next slide. Partnerships and an inclusive process seem to be a theme throughout this NOFO and are specifically identified as one of the 6 policy priority areas. So I'm going to talk about what documentation for this looks like in a few minutes, but really thinking about having this broad array of stakeholders, having partnerships that are robust, and ensuring that we have an inclusive process must be part of the CoC's plan. That means bringing partners like affordable housing developers, your government housing agencies, public housing authorities, healthcare and behavioral health providers, and others to the table, and leveraging those systems and resources so that we are maximizing the impact that this NOFO can have on reducing unsheltered homelessness. HUD is also clearly stating that successful plans will center equity, as Josh explained, including how the continuum of care will reach and serve underserved populations and historically marginalized people who are more likely to experience homelessness. And then lastly, but certainly very important, is using a housing first approach in this work. And so I used to write these NOFOs when I was at HUD. I spent a lot of years writing them, and now I get to be on the outside and tell you some of the things that I pick up on when I read these documents now. And what I will say is, if you look at this description under using a housing first approach, HUD specifically used the word correctly implementing a housing first approach. And what that means to me is that this is not about checking a box that says that you're doing housing first and then implementing in a way that doesn't have fidelity to the evidence-based model. This is about correctly implementing a housing first approach at the local level. And therefore, we encourage all applicants and continuums of care to understand what a successful housing first model looks like and what evidence there is for those models, and incorporate those policies and practices into your plan in really robust ways. Next slide, please. I get to say things now that I didn't used to get to say when I was inside of the government, so that feels good that I was able to point that out for folks. Turning to available funding and grant terms, there's lots of information in the NOFO that you should pick up on, but there's a few things that I want to note on this slide. First, you can calculate the possible maximum award for your area so that you can understand how much you can apply for, as shown on this chart, for both the unsheltered homelessness set aside and the rural set aside. So you can see there that HUD has set some maximum amounts that communities are capped at, that is based on PPRN or some other calculation. But we want you to remember, as you're thinking about that amount of money, we want to remember that the grant terms are for 3 years in most cases. On the unsheltered homelessness set aside, planning and UFA funds are only available on the unsheltered homelessness set aside, and hard costs like acquisition, new construction, or rehab are only available on the rural set aside. So just as you're thinking about how much money you can apply for. Just remember to keep that in mind because that is a little bit different than the regular continuum of care program these days. Next slide. So here we are. We've talked about the policy priorities. That is what HUD wants to accomplish with this NOFO. So now we're going to talk about scoring. I'm going to start with the unsheltered set aside. Josh will wrap us up with the rural set aside. But I also just one more time want to note that there's a ton of detail in the NOFO itself. My NOFO is highlighted and tabbed in a lot of places. This is really a high level review. So you need to look at the NOFO itself in some detail. And just a reminder that we have some summary documents that we've posted on our website to sort of help you navigate that NOFO that has page numbers and section references. So it just makes it a little bit easier to read. Okay, there we go. Great. So for the unsheltered homelessness set aside, this is probably one of the most important technical things you need to understand. It is funded at the continuum of care level. That means that CoCs will be selected for funding, including all rated and ranked projects that meet the criteria and pass threshold. So for the unsheltered homelessness set aside, you're really looking at, is your continuum funded or not? That is not the case for the rural program, and Josh will talk about that in a minute, but I want to focus a little bit on the unsheltered homelessness set aside. And HUD is also really clear about the plan. The plan is worth most of the points, as we'll get into in a moment. And in that plan, CoCs must demonstrate a comprehensive, coordinated approach to reducing unsheltered homelessness. The approach has to be grounded in housing first and public health principles. And it includes improving service engagement, health outcomes, housing stability among highly vulnerable, unsheltered individuals and families. And so for the person who asked in the chat or in the Q&A earlier about whether families are eligible, they are. This is about individuals and families. Next slide, please. So here are the high-level factors that are going to be used by HUD to establish the Continuum of Care score. The Continuum of Care score determines which CoCs get funded for the unsheltered set aside. So broadly, there are 4 categories of points that include both qualitative and quantitative criteria. So as I mentioned a minute ago, the largest number of points is for the Continuum of Care plan, which is worth up to 70 points for the unsheltered set aside and up to 59 points for the rural set aside. So my side note here is, as you go through the application, you will see that there are some questions that everybody, no matter whether you're asking for unsheltered funding or rural funding, that everybody has to answer. And there are some questions that the rural communities do not have to answer, or that they only have to answer. So you have to be really careful about how you're going through the criteria and ensuring that you understand which pieces have to be answered based on what types of applications that you're submitting. But so this CoC plan is the biggest number of points. Again, for the unsheltered set aside, it's 70 points. For the rural set aside, up to 59 points. This part of the application is limited to 15 pages. And again, as somebody who used to read these applications quite a bit, I'm going to impart some advice here. You need to be concise in your language and deliberate in your language and your plans. You need to clearly address every factor that's identified by HUD in the NOFO and the application materials. Do not make them guess what you mean. Be as concise as you can. It is very hard to score a narrative, and it's so much easier when the narrative is really clear and concise in its language. So the next highest number of points, as you can see, for determining who will get the unsheltered set-aside funding is the bonus, and that is up to 30 points. And it is based on the number of unsheltered people in your continuum of care as reported to HUD in the 2019 point in time count. So you need to take a look at that data that you have from the 2019 point in time count. There is a sliding scale that HUD has published as part of the NOFO, and determine how many of those points your community is eligible to receive. That'll help you decide how competitive you might be and how you decide to proceed with your plan. But we would highly recommend that and encourage communities that fit into that category with the highest number of points available, which is 10,000 or more unsheltered people in the 2019 NOFA, in the 2019 point in time count, to apply for funding under this NOFO. That means that HUD has determined that communities who have more than 10,000 or more unsheltered people are really their priority. Remember, I said HUD tells you what their priorities are in two ways, through the policy priorities and through scoring. This is a really big indication of what HUD is trying to accomplish here. So the other types of criteria and factors that are going to be used to establish the CoC score for unsheltered are included here, and I think are more familiar criteria for us who have done these kinds of applications quite a bit in the past, like performance, coordination and engagement, project capacity review, and ranking. So again, that was a super high level look at how HUD is going to establish the CoC score for the unsheltered set aside. But again, everybody should be reading that NOFO in a lot of detail to understand all of the specifics that are related to those broad criteria and sort of buckets. Let's go to the next slide. Before we move on to talk about the rural project scoring, we want to highlight some additional items that we think you should be thinking about and considering right now as you're determining how you want to proceed. The NOFO specifically awards points in a number of places that have to do with inclusion, coordination, collaboration, and partnerships. So you all are going to very quickly need to consider whether your CoC has these types of partnerships already in place, or whether you need to start developing them. And specifically, we think that you need to start considering housing resources that can be brought to the table for this NOFO. That likely means, as I said before, that you're going to be talking with your government's housing department, affordable housing developers, public housing authorities and agencies, and landlords. You can see here that there's 8 points in the NOFO for landlord recruitment plans and initiatives. And that is something that is a little bit different than what we've seen in the regular continuum of care application in the past. So first, what kind of housing resources can be brought to bear, and what kind of partnerships do you already have in place or need to build in order to be successful in this application? Second, same thing goes for healthcare and behavioral health services that can really connect people experiencing homelessness with the services they need and want. So that means you need to be talking with your FQHCs and your local healthcare providers and behavioral health mainstream systems in order to have those folks at the table so that you can create these partnerships if you don't already have them. And then third, we hope that people are, COCs and leaders are thinking about how you reach and competently serve underserved communities and historically marginalized people who have not been historically reached by the Continuum of Care program. So what non-traditional partners can you bring to the table to help reach those communities? So we want to make sure that we have mainstream systems and maybe these non-traditional partners and housing partners all at the table together in order to maximize this funding and the impact that this funding can have. Next slide, please. So HUD provided examples of the types of written agreements that they are looking for in the NOFO. This very importantly includes not just the groups that we just talked about on the previous slide, but also people with lived expertise and having people with lived expertise not just included in the planning and execution of the plan that is submitted, but also actually providing a written commitment letter. And then the last thing on this slide that I want to draw your attention to is the bottom row, which is about a PHA commitment letter. Although we do not know the details yet, in their opening webinar on this NOFO, we had folks from the Office of Public and Indian Housing on the webinar, and HUD said that they plan to release new vouchers to be used in conjunction with these funds, the funds that are being made available under this NOFO. So if I had to guess what that means, I would guess that the PHA letter discussed here in this last row of the partnership commitments and in more detail in the NOFO is going to be really important and key for how communities and whether communities will be able to access the vouchers that are made available through that upcoming opportunity that HUD said that they will release. So if you don't have a close relationship with your public housing authority or agency, that's something that we think is really important, although you should if you're doing emergency housing vouchers with them now. But if you don't, that's something you want to start working on very soon because it seems like it will be incredibly important for leveraging that upcoming opportunity. Next slide, please. So lastly, in this broad overview that we're talking about today, we want to be sure that COCs are thinking about using evidence-based approaches, including Housing First, and improving their data. HUD detailed several factors in the scoring that are related to evidence as detailed on this slide and as previously discussed. Housing First and street outreach have such components, and improving data is also described in the NOFO. So these are things that we think that folks should be paying close attention to, especially when you're thinking about, again, these evidence-based approaches, having fidelity to an evidence-based model and ensuring that your data is as good as it can possibly be. So if we can go to the next slide, I think Christy is going to take some of these links and put them into the chat. But we just wanted to provide some links, some places where you can go to look at some of the evidence that you could use to do this work in your community. Under recent studies in that one-pager or multi-pager from the National Low Income Housing Coalition, there are some great studies that you can look at around Housing First. We also know that programs like Pathways and others have great evidence for their approaches, and you can go to their websites to look at what they do. For outreach, the National Healthcare for the Homeless Council provides lots of documentation and evidence around their particular work, including outreach. If you were thinking about implementing an assertive community treatment model, there are some additional resources there for you. And as always, CSH, the Corporation for Supportive Housing, has quite a few documents up on their website that are really about frequent system users and what models work best for them. We will continue to release additional information and resources on these evidence-based approaches in the future, so stay tuned. And with that, I am going to turn it back to Josh so that we can talk a little bit about the rural homelessness set aside.
All right, thank you, Ann. So I think Corey in the chat just said, can we talk a little bit about the rural homelessness set aside? And it was right. It was the time. It was right on time. So we're going to spend a little bit of time, and I think we'll continue to ensure we're sending out resources and disseminating relevant information that you all are asking for. So I'll spend a little bit of time talking about the rural set aside, which again, as Ann mentioned, it's going to be selected. Projects will be selected for funding based on their application score using a 100-point scale. The Unsheltered one was CoCs being funded, but again, the rural is projects being funded. With understanding that tribal areas now are newly eligible to receive COC funding, it appears to be a focus. So if folks, we'd encourage folks to start reaching out now to start building those relationships in that capacity, and just to highlight some of the eligible uses of this funds, as probably echo some of the things that Ann mentioned earlier. But we talk rapid housing, street outreach, HMIS, capacity building. This could be used for hotel motel. This can add more shelter beds to an existing a shelter. Could pay for some arrears with limits, and then also have some capital funding that could be pay for some smaller rehabilitation, specifically with if a unit needs some minor renovations to pass inspection, right? Those funds can be used towards that. So. And again, just the biggest takeaway, this is a project level competition. So the projects we scored up with a total of 100 points, and half of these is of that is the COC score, and then 40 points is where the COC project is ranked. But we do want to highlight how the section about the geographic, 10 points were the geographic areas that have high levels of homelessness, housing distress, distress or poverty, and are located where COC services have been entirely unavailable, which again includes tribal areas, those trust lands, reservations, and then there'll be more information to come on that. So we just wanted to highlight that last section of serving structurally disadvantaged areas as 10 points in the scoring priority. So we also want to highlight that these resources, there's a ton of one-pagers and resources available on the Alliance's website, and continue to check back. We're building in real time, so there'll continue to be new resources and items put on there. Hopefully I think Christy will put that in the chat so you all have access just to the resting page for these NOFO resources. All right, so we without scripting it, perfect timing to have about 10 minutes for some good questions. We've had you guys have been really There's been a lot of questions throughout our, our time, and hopefully, even if we can't get to every single question, we'll be able to provide some resources and some follow-up guidance that will. This one's very specific to that 15-page narrative advice. Can you restate some of the things you were saying about that, Anne, in regards to how to approach that?
Yeah. So, I mean, again, this is just sort of based on my own experience with reading narratives, both at HUD and in other places. I would say, 15 pages is not a ton of space to really lay out your plan. So make sure that your language is really concise and that you are addressing very clearly addressing every factor that HUD needs you to address within that 15-page limitation, and don't make them guess as to whether you're answering one criteria or another. Be as clear as you can and use language as concisely as you can in order so that when there is somebody who's reading those applications, they know exactly what you mean. So, I mean, it's general, it's sort of general advice about how to write those kinds of narratives, but just understanding that folks are actually reading them and having to interpret if you're not clear about what you're responding to and responding to every single factor.
Right, thank you for that, Anne. Can you speak a little bit more to the eligibility of who's eligible to apply? I guess maybe we can speak to the unsheltered, the COCs, and then the rural set aside. Can you speak a little bit more to that?
Sure. So the way that COCs can apply for this funding, and they can apply. I see Brian had a question in the Q&A as well about splitting money between unsheltered and rural set-asides. So COCs have to apply for funding. You have to be a continuum of care to apply for this funding. But the COC as a whole will be funded or not funded under the unsheltered homelessness set-aside, but specific projects will be funded or not funded based on their score under the rural homelessness set-aside. So there will be sort of a COC application component, whether you are applying for just rural or just unsheltered or both. Where I think that there is likely going to be the differentiation is in eSNAPs, there are priority listings, as most of you know, and there will be different priority listings for the different funding opportunities, is the way that I read it in the NOFO. So again, you are going to get application materials from HUD that lay out all of the details on how to do that. But either way, your continuum of care is going to have to be the applicant, as is the normal, in the normal continuum of care application process. The COC has to submit the plan and all the projects.
Thanks, Anne. I've been seeing some questions just in regards to some of the bonus points and how it's really gearing itself towards communities with larger numbers of unsheltered homelessness. And so I saw a couple questions of like, should smaller COCs apply? I know you kind of talked about it at the kind of start of the webinar. Can you speak more to like, should COCs apply if they don't feel like they're going to be as competitive? What are your thoughts?
So I did talk a little bit about this at the top, and I think we at the Alliance feel pretty strongly that all communities should think about this in the context of what's happening locally if there has been an increase in unsheltered homelessness. Even though HUD is determining this year that this is how they're going to use their recapture dollars, it's possible that in the future we're going to have other set-asides for unsheltered homelessness or rural homelessness as well. So I really would encourage communities to think about this as an opportunity to do, to have a plan in place, to get a plan in place to address unsheltered homelessness within your community, even if you decide not to apply or if you don't think that you're going to be competitive because the numbers are too low compared to other CoCs. Because we don't know whether HUD is going to put another one of these NOFOs out, whether Congress is going to say, oh, HUD did the administration did a great thing and we're moving the needle on unsheltered homelessness, and then they make additional, investments in this area. And I hope that by having those plans in place, you will actually be doing better in your regular continuum of care competition process than if you don't. So I would just encourage communities to think about it in that way, in addition to preparing an actual application, if that's the way that you decide to go.
Thank you, Ann. Just to answer some of the easier questions, yes, this will be recorded. We'll make sure that we send out the chat and the PowerPoint to you all after the webinar is over. I'm trying to find some comment. There's a lot of questions. Again, if we don't get to your question, we will ensure we'll answer those.
I would note that there were a couple of questions about coordinated entry. I think it's important to know that one of the eligible types of projects is an SSO to support an expansion of coordinated entry if you need that in order to address unsheltered homelessness in your community. So there is an opportunity here to do that, and because SSOs for coordinated entry are eligible projects.
When you talked about like the available funds and the grant terms, and roughly that for 3 years. Is there any information about that? Any money that's going to come after that, potentially to?
Yeah, that was a good question. I think Brian had that question as well. Because this is continuum of care funding, so I think that the question was twofold. Will these be renewable? And I believe that it's fine, Brian, I don't mind having lots of questions. Is this renewable? Because this is through the Continuum of Care program, this is very clearly funded as a Continuum of Care grant. The assumption is that these are all renewable. But the second part of that question was, will we have to cut programs if Congress cuts funding for this? And I think that that is always it's always a risk, but it's a risk that we've all been willing to take over all of these years, because Congress usually does fund and provide enough funding to HUD to fund all renewals in a given year. But it also just gives me an opportunity to plug that everybody should be doing their part to make sure that their members of Congress are, especially those who are on the appropriations committee and the THUD subcommittee in particular, that they know how important the homeless assistance grants funding is to you and your community and to people experiencing homelessness in your area, to make sure that they know how important this funding is and they are covering it in the future.
All right, well, we have a minute left, and I just see one quick email, one question just about like how should the funds be used, and I would just, is the best use of funds for Unsheltered to enhance ESG funding street outreach? I would just say it depends on your community, right? What does your community need? Looking at your data, what are some of the biggest gaps? So that's what I would always recommend. There's not a one size fits all. Each of you all's community looks different and needs different things. But I do want to say thank you all for your time. Thank you.
Wait, can I add one thing to that, Josh, before we close? please ask people who are experiencing homelessness in your community what they want and need, and include them in your process. Not only do you get points for it, but it is the right thing to do. It is the equitable thing to do. And that, I think, just to add that one point onto what Josh said, which I completely agree with.
Absolutely. All right. And yes, ask the experts.
Right.
All right. Well, thank you all. Have a great rest of your day, and we will try our best to get all this information back out to you. Really great questions. Thank you.
Great. Thank you, everybody.
Thank you for all your hard work and all the work you do.